white blood cells, which is also called as leukocytes. So this white blood cells, it is basically classified into granulocytes and agranulocytes. So granulocytes includes eosinophils, basophils, neutrophils. Agranulocytes includes monocytes and lymphocytes. Okay, so granulocytes, meaning that it has granules. So granulocytes means it has granules. And the nucleus has lobes. Whereas agranulocytes, there is no granules and no lobes in the nucleus. Okay, so now we will see the differences regarding the granules and other things. Okay, so basophil eosinophils has the nucleus. I will show this picture. So first look into the eosinophils. So eosinophils, the nucleus, it is bilobed shape. Both eosinophils and basophils has eosinophils, basophils and neutrophils. Okay, the eosinophil is having bilobed nucleus. Basophils is also having bilobed nucleus, whereas neutrophil is multilobed nucleus. Okay, so look into the eosinophils over here. Okay, this is the eosinophil. So when you look into this eosinophil, it is bilobed. The most common shape of the lobe is headphone appearance or the dumbbell shaped appearance. So either it will be headphone shape or dumbbell shape. This is how most of the eosinophilic nucleus will be present. Okay, so this is how you will get either this. It may remain in any shape. So it is headphone shape or bilobe shape or the double shaped nucleus. And now coming to the basophils, this is also bilobe, mostly similar to that of the eosinophils, but how to differentiate, I will tell you. And coming to the neutrophils, it is multi-lobe in the sense you have the multiple lobes which is connected via the thin strands. Okay, clear? So this is the neutrophil. So now when you look into the slide, when whatever you are preparing during the differential leukocyte count. So eosinophils, as the name eosinophil, it is stained with eosin molecules. So it will contain the eosin stained nucleus and the granules which is being present like this. So they are called as coarse granules. Whereas in the basophils, it is basophilic. So it will get the blue colored granules. This is also coarse granules, but the granules will occupy over the nucleus also. And you was not able to see the nucleus clearly because even over the nucleus, the granules will be present. Whereas in case of neutrophils, it is neutro, means it has both eosinophilic and basophilic granules, but it is very small granules, that is called as fine granules. So it has both eosinophilic and basophilic appearance. So this is how the granulocytes is present based on the granules, because it is called as granulocytes. And now look into the picture. You can easily see the eosinophils, the bilobe shaped nucleus, and the basophils also bilobe, but the nucleus is completely covered by the granules. And the neutrophils, it is multi-lobed. You have more than 2 to 3 lobes. So this is how you will identify the granulocytes. And now moving on to the agranulocytes. So here the nucleus is not having the lobes. There is no granules also. So you have a clear single nucleus. Okay. So mostly the nucleus of the monocytes, it will be kidney shaped nucleus. Okay, we can easily appreciate the monocyte kidney shaped nucleus. Whereas in lymphocyte, oval nucleus, just a round nucleus, and only if you see a thin rim of cytoplasm is being seen. Most cases you cannot appreciate the cytoplasm also, because the nucleus will occupy almost the entire cell. So this is how the monocytes and the lymphocytes will be visualized. Okay. And now coming to the composition. When you take the differential leukocyte count, so differential leukocyte count, you will be appreciating 100 cells. So you will tell the cells in the percentage. So the basophils, it is only 0.5 to 1%. That is always less than 1%. So normally basophils cannot be seen in a normal differential leukocyte count. And eosinophils, it is 2 to 4%, whereas neutrophils, it is nearly 50 to 70%. So maximum of the white blood cells, what we see is the neutrophils. Followed by that, you can see eosinophils and the monocytes, which constitutes 3 to 8%, and the lymphocytes, it constitutes 25 to 45%. So predominant one is the neutrophils, then the lymphocytes, and then you have monocytes, eosinophils, but very, very, very rare to see the basophils. If you are seeing basophils, it means that you are been having some infection. Okay, clear? So this is how you will calculate. And then when regarding the nucleus of the neutrophils, it was being termed as multi-lobed nucleus, but it was not defined only 2 or 3 or 4. Okay, the number of lobes will tell you the age of the neutrophils. At the same time, in case of megaloblastic anemia, you will have more than that of the 5 to 6 lobes. Okay, so when you look into the slide, that question was being asked in this image question of this December 2021 exam. The multiple lobed neutrophils having more than the 5 lobes, then surely you can tell it as megaloblastic anemia. So this counting of the number of lobes of the neutrophils is made by the special count that is called as Arnith count. So this is the count which is used to find the lobes of the neutrophils. Okay, so in one of the image-based question, this was being asked. That is, you will also study that in the pathology, megaloblastic anemia. If you want to find it with the slides, then you have to look for the blast cells. Along with that, you have to look for the multiple lobe nucleus, that is more than 5 to 6 lobes. Okay, that is about the white blood cells. And now moving on to the functions. Eosinophils, main function, it is present during allergic conditions. And basophils, eosinophils mainly you can see in the parasitic infections. Okay, and basophils during the allergic infections, and neutrophils mostly in all the bacterial and viral infections. Neutrophil counts will be high, because neutrophils are the one which acts as a, which modify itself as a macrophage cells, and it will always try to fight against the foreign materials to engulf and kill it. And same way lymphocytes and monocytes. Lymphocytes is mostly predominant because it is the one which is giving rise to the T cells and B cells during the infectious conditions, where the T cells will kill by forming the signals to the T helper cells, T cytotoxic cells, and T suppressor cells. And the basophils are the one which is giving rise to the plasma cells and the memory cells. The plasma cells is the one which is going to produce the antibodies against the foreign antigens. So that is the reason, on the whole, overall, white blood cell acts as a first line defense mechanism. Okay, so its major role is to function as a immune cell. Okay, clear? So that is the main function of WBCs.